My name's Hannah. I'm a doctor and English tutor from England. Today I would like to talk about the communications criteria for the speaking section of the Occupational English test. In this video, I'll be talking about the relationship building criteria. I'll be talking about exactly what the criteria mean and giving you some helpful phrases that you might find useful to incorporate into your speaking exam. A quick note on phrases. I know it's very important to not just memorize phrases, as this will not give you good marks for the exam. However, even in my personal communication skills exams, I find it sometimes helpful to have a bank or a library of phrases where I can draw on some pre-thought about phrases to use for different communication scenarios. If you're not familiar with the OET speaking criteria and the mark scheme, I suggest that you either check out my video, which is up here somewhere, or you go straight to the OET website and have a look through the official marking criteria before we then dive in and look in detail at the relationship criteria. So this is our relationship building criteria as part of the communication criteria for OET speaking. I have these definitions from the glossary section available on the OET website. There is a maximum of 3 points in total for overall how proficiently you can use these criteria in your speaking exam. And for that, we have to initiate the interaction appropriately. We have to demonstrate an attentive and respectful attitude. We have to demonstrate a non-judgmental approach, and we have to show empathy. In the next couple of minutes, I'm going to go through each of these criteria with some useful phrases that may be appropriate to help demonstrate these skills. Let's look at initiating the interaction appropriately. For this, you need to introduce yourself, clarify the patient's name, clarify your role, and if necessary, explain what is next going to happen. For example, good morning. My name is Dr. Joanne Smith. I am your general practitioner. Before we start, can I check your name? Then, after the name, thank you, Mrs. Brown. Now tell me, what has brought you in to see me today? This is a standard open introduction for a straightforward general practitioner kind of case. Or, hello, I am Dr. Joanne Smith. I am one of the surgical doctors. Firstly, can I check how you would prefer to be called? Thank you, John. I understand you have asked to see me as you have some concerns about your operation. I am here to answer your questions as best I can. This is for the sort of scenario that you're likely to see on OET cards where you already know some of the reasoning that you're speaking to the patient, and you can therefore clarify that with them and explain your role in a bit more depth. A lot of students ask at this point what to do if from the card it looks like you may have met the patient before. My personal advice for this is, unless it explicitly says on the card that you have met the patient before, assume that this is your first interaction. If it explicitly says that you have met the patient before, for example, you may have requested some tests for them at a previous appointment, I would still say, as a reminder, my name is Dr. Joanne Smith, and before we start, can you remind me of your name? Therefore, you're acknowledging the scenario that you've already met the patient. However, you're still making sure that the examiner cannot deduct you marks for not having introduced yourself and for asking the patient's name. Let's move on for demonstrating an attentive and respectful attitude. To show attentiveness and respect, it's useful to do active listening. Include sounds such as and I see, especially as you are marked from a tape recording. Therefore, any nodding or other non-verbal forms of active listening will not be helpful. Ensuring the patient understands your motivation. This is often referring to when you have a difference in opinion. And it's important here to show that the reason you disagree with them is still for their best interests. Phrases you could use are, I can see we have a difference in opinion, but I can assure you I have your best interests at heart. Or, I want to ensure your daughter gets the best possible treatment, and it is for that reason that I'm referring her to hospital. Asking permission and consent to proceed. This means acknowledging anything that may be difficult for the patient. For example, I can see you are understandably upset, but is it okay if I ask you a few more questions? Many people feel embarrassed about such topics, but it is important I ask some more questions in order for me to help you. Would that be okay? Let's look at demonstrating a non-judgmental approach. Avoid anything judgmental, such as shocked statements such as wow, telling patients what they must do, telling patients they are wrong, or insisting that patients should agree with you. Instead, use phrases such as, I would strongly advise that you take this medication, for example. Or if they do have a misconception, acknowledge their feelings and say, it is understandable to think that. However, studies have shown that in fact, and present the correct information. If a patient disagrees with the management plan, you can say, I can see that this is a big decision. Why don't I give you a leaflet and you can discuss it with your family? I will make you an appointment to discuss this further in the future. The great thing about the OET test is you can always use the leaflet approach, regardless of whether an actual leaflet in fact exists. Showing empathy. Here, again, it is very helpful to exaggerate the non-verbal behavior. In real life, techniques such as eye contact, nodding, etc. can be really helpful for empathy, but it's difficult to express this on a tape recorder. Some useful phrases to show empathy include these. It sounds like this has been a stressful time for you. It seems to me that this has been a big worry for you. I can see that you appear to be very upset by this. Would you like to talk more about that? I'm very sorry to hear that. It is very important to avoid saying, I understand how you feel. And I would also be careful with simply saying, I understand. It is very unlikely that you have been in the exact same situation as the patient is in. Therefore, a patient who is already upset or going through a difficult time can easily feel in their head that you can't actually possibly understand. Instead, it is helpful to say something like, it is understandable to feel worried or upset or frustrated in this situation, depending on the circumstances. Or, I appreciate that this has been worrying or upsetting for you. Therefore, you're acknowledging their feelings and acknowledging that these are normal feelings to have without overstepping the mark and saying that you directly understand. As without living their experience, you can't ever understand exactly how it feels. I hope you found those phrases useful and something that you can adapt and use in your OET speaking. Let me know if you'd like to see any other videos. Have a look at some of my other OET videos that should be popping up around, and subscribe to my channel for more OET updates. Best of luck in your exam. Bye!